Hi, my name is Sarah, and I'm going to be doing the HEENT assessment, or the Head, Eyes, Ears, Nose, and Throat assessment. And today I will be using my patient right here to do these fun things. So to begin my assessment, I'm going to gather my equipment, which I will be using an otoscope and a pen light. And I am going to go in my patient's room, provide privacy by closing the door, closing the curtain, whichever is needed for the environment, and I'm going to do my hand hygiene as I walk in. I'm going to start my assessment by looking at the appearance of my patient. I'm just going to be looking if they have any obvious physical deformities, just the general appearance that they appear to be in. If they look like they're keeping up with their personal hygiene very well, looking at their clothing, seeing if it is appropriate for the season. My patient today is wearing a white jacket, so that seems to be very appropriate since it is just the beginning of February and it is chilly. And I'm also just going to be looking to see if they have a clean appearance and if it is neat and well kept. Throughout my assessment, I'm going to be looking at skin color to make sure that there aren't any obvious changes within the skin color. And I will be also looking just at eye contact, their level of orientation, seeing if their oriented time score, and their nutritional status. And as I communicate, I will be assessing their mood, their speech, and their hearing. So to start, I'm going to start with the head, and I'm going to be looking for eye contact, the level of consciousness and orientation, and I will be palpating various things. So I'm going to start with the head, and I'm going to be palpating the scalp, and I'm just going to be feeling for any hardness, deformities, or anything that is not smooth or symmetrical. So I'm just going to move my fingers through the hair, feeling for anything that's not congruent with anything. I do not feel any masses, so that is a good sign. And the hair seems to be very well kept, and so that's another thing I can be looking at. I'm going to be looking at her face, seeing that it is symmetrical. I'm not seeing any involuntary movement, and everything seems to be well. Next, I'm going to be feeling for the temporal artery. And I'm able to feel it, and it is equal bilaterally. I'm also going to be feeling for the temporal mandibular joint, where the bones meet. I'm going to have you open your mouth and then close it. And open it one more time and close it. Right, and I can feel that move, and I'm not hearing a popping sound or I'm not feeling it jolt out of place. It's very smooth and it's equal on both sides. I'm also going to be feeling for the maxillary and the frontal sinuses. I'm going to be feeling for any kind of swelling. I'm going to have you tell me if it's tender in any way. No, no swelling. Okay, so that's good. And next I'm going to be moving to the eyes, and I'll be starting with the peripheral vision test. So I'm going to be moving my fingers in your visual field, towards your visual field. I'm going to have you tell me when you can see them. So I'll do it in a few various places. Okay, and then I'm just going to move my fingers around, okay, to different corners. Okay, alright. So I was just assessing where her visual field ends for her peripheral vision. And now I'll be doing the light reflexes. And I'm looking for the pupils to constrict directly as well as consensually. So directly is when I'm doing the right side, that the right pupil constricts, and same on the left. And then consensually is when I'm shining the light into her left eye, and I'm seeing the right eye, the right pupil constrict, and then vice versa. Next, I'm just going to be doing a simple cover test. So I will hold this napkin over your left eye for a few seconds, and I'm just going to hold it here, and then when I remove it, I'll see if her eye has drifted to any side, up or down, or from side to side, and it has not. I'm going to be doing the same assessment on the right eye. And her right eye was able to stay focused straight ahead while I held the napkin in front of her eye. I'm also going to be assessing for the 6 cardinal areas. So I'm going to have you follow my pen light. So I'll be moving up, and I'll keep your head still. And then I'll also be doing the corners. And I just want to see if our eyes are able to move smoothly. This is just assessing cranial nerves as well as eye muscles. So I'm making sure to do every corner, and then up, down, and left to right. And our eye movements are very smooth. I'm going to also move this penlight towards your nose. Great. So now I'm just going to be assessing what the eye looks like in general. All the external structures. I'm going to be looking at the sclera, and the corneas, and the pupils as well. So I'm going to be pulling the bottom eyelids down a little bit, and I can see weakness and some moistness. I'm going to assess for any bleeding. I don't see any kind of bleeding. And her conjunctiva are clear, and the sclera is white. And so I'm also going to do a Snellen chart, and that is going to include having the chart 20 feet away from my patient, and I will have them start with the biggest letter and move their way down various lines on the chart, and they get smaller each time until they can't read what the letters are anymore. And with that, that can kind of determine just their and kind of give a number on where they are at visually. Lastly, I will make sure I've done perla, which will determine that the pupils are round, reactive to light, accommodating, and equal, and which throughout my assessment I was able to determine that they are. Next, I'm moving to the ears, so I'm going to start with the outside of the ears, looking for any signs of drainage or any kind of lesions or abrasions within the ear. I do not see on the left, and I do not see any on the right. Then I will be moving into the inner ear with my otoscope, and I'm going to be looking through the ear canal all the way to the tympanic membrane, just making sure I'm pulling the ear up and backwards a little bit for my adult patient. With my patient, I can see through the ear canal of the tympanic membrane. It appears to be intact. But only thing I am able to notice within her ears is a little bit of earwax buildup, but no obvious signs of any kind of bleeding or trauma to her ear. So I'm also going to assess her right ear, doing the same thing, pulling the ear up and back. And I come out with about the same findings on her right ear, with some wax buildup, but I'm not seeing any kind of break in the skin within her inner ear canal. I'm also going to be doing a whisper test, so I will cover one ear and whisper in the other, and I'll have you tell me which or what word I have whispered in your ear. Baseball. Apple. And she was able to repeat the words to me as I have whispered them in her ear. Next, I'll be doing her nose. I'm just going to be looking, see that it's symmetrical on her face. I'm not seeing any dryness or redness, and no breakdown of skin around her nose. I'm going to test the patency of each nostril. So I'll have her breathe in while I hold one side, and then I'll have her breathe in while I hold the other. And both sides appear to be very patent. No signs of extra effort was needed to breathe through her nose. I'm also going to be observing the nose on the inside and have you lean your head back just a little bit. I'm looking for any kind of drainage or lesions, which I do not see any. And mucosa seems to be dry and a little pink, which is good. And the septum is in the center, and the turbinates are intact. Now I'm going to be going down through her mouth and just looking at her teeth, her tongue, the buccal mucosa, and palate and the floor of her mouth as well. I'm going to have you open your mouth for me. I'm going to have you stick out your tongue. You say, ah. Ah. Your uvula is able to move freely. It's in the center. I will grade the tonsils at a 1. They do not appear to be swollen. Your buccal mucosa are intact. It's pink and moist. I'm going to have you raise your tongue for me. This under her tongue is also moist and pink and intact. And her teeth do not have any cracks or any kind of breakdown. Her gums appear to be intact as well. Now I'm going to be moving down to the neck. And so I'm just going to be looking at the neck right now, seeing if there's any kind of masses or anything obvious like jugular vein distension, which I do not see on my patient. I'm going to palpate throughout the lymph nodes of the neck and head, and I'll be feeling for the carotid pressure or pulse as well. So I'm starting with the lymph nodes. Alright, and have you turn your head to your left. And then to your right. Straight ahead for me. And then I'll feel for the carotid pulse. And I'm doing one side at a time for the carotid pulse. And I do not feel any kind of bumps or swelling or anything out of the ordinary for her lymph nodes. I'm also going to be palpating for the trachea and the thyroid. So for the trachea, I'm just going to be feeling, making sure that it is in the center. I'm not feeling it drift to one side. I'm going to have you look to your right. Take a feel for the thyroid, and then to your left. And this is not going to be swollen. I'm lastly going to have you just do your range of motion with your neck, and if it's painful at any time, stop and let me know. So I'm going to have you put your chin to your chest, and then look up at the ceiling, and put your right ear to your right shoulder, and then your left ear to your left shoulder. Okay, now I'm going to do a few movements with resistance. So lean to your left again. Great. And then lean to your right. And then I'm going to place my hands on your shoulders and have you shrug. Good job. And that concludes my head, eyes, ears, nose, and throat assessment for my patient. And that is all.